The White House COVID response team today says it's focusing on a plan to understand and treat long COVID. Conditions or symptoms that some people who already got the virus might still be feeling. Maybe you know somebody who's struggling with long COVID. The national research team now plans to study 40,000 people to look at how they've been affected months after they got the virus. And today, the CDC is also laying out who should and should not get a fourth shot. The agency's director talking exclusively, you see here, with our own Erika Edwards for the first time since the CDC recommended a second booster for adults ages 50 and up. Dr. Rochelle Walensky saying there's no downside to getting another shot and that Omicron counts as a natural boost for the vaccinated. Listen.
For those people, even with high-risk conditions or over the age of 65, if you recently had Omicron, that probably served as your natural boost. So you probably don't need one yet because you just recently had yourself a natural boost. In those situations, you may want to wait 2 or 3 or 4 months before you get another boost.
Erika Edwards is joining us now. Erika, great interview with Dr. Walensky, great exclusive. What else did she tell you?
Yeah, so in addition to Omicron being sort of that natural boost for people who otherwise are up to date on their COVID vaccines, she also clarified that healthy people between the ages of 50 and 65 who technically qualify for that second booster may not actually need one, especially as COVID cases, hospitalizations, and deaths continue to fall across most of the country. Dr. Walensky also said that, the next step for her and other public health officials is to really try to figure out what's going to happen this fall. Will we need a fifth shot, a third booster, whatever you want to call it at this point? Here's what she had to say.
The next step is we at CDC and the FDA are going to be putting our heads together at the VRBPAC meeting tomorrow, actually, and continue to engage in discussions about what the next phase of this looks like. What will the next vaccine be? How will we prepare for the future? And what will the fall look like?
Now, she also said there's no danger, there's no known side effect or risk if you want to get a booster now, plus potentially another one in the fall should one become available. Hallie?
Let me ask you about this deeper look into long COVID. We know the National Institutes of Health started looking into this last fall. Why are we back on this now?
Well, in part to light a fire under this sluggish billion-dollar study that was announced by NIH actually in February of 2021. It aimed to enroll 20,000 long COVID patients. When I checked in a year later, this past February, the study had only enrolled just over 1,000 patients.
Oh, wow.
Now, today's actions are expected to accelerate that enrollment and actually increase it to 40,000 patients.
Before
Hallie?
I let you go, I know that Dr. Walensky talked about or is getting a lot of questions about what this revamp of this agency would look like. She didn't talk about that, but she I know, is facing questions on that here. We don't know what this revamp looks like yet, right? What should we be keeping an eye on our radar for?
Yeah, so this is going to be a month-long review led by a senior member, longtime member of the HHS. It's going to be a multi-layered approach to this kind of review, in part to try to modernize its data collection process, especially the data that it's getting from state health departments. I remember early on in the pandemic, trying to get numbers, especially from the states, was difficult because a lot of times they were still using pen and paper. Otherwise, they just want to work on creating faster responses to future outbreaks, as well as providing more clear communication from public health officials on their recommendations. That review is expected to start next Monday, the 11th.
Erika Edwards, great to see you. Thank you very much for bringing us that reporting. Appreciate it.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.